Is the Baucus bill the right solution for America's healthcare system? Let's ask Ryan Ellis from Americans for Tax Reform and Myrtle Potter, CNBC contributor, former COO, and president of Genentech. So, Myrtle, you've got a revolt from the insurance companies, and also I noticed from the hospital trade group, the doctors trade group. What's your take? What are you thinking about this now?
Well, I'm thinking that the games are just about to begin. Having gone through committee and being so close, which I think we will get this bill passed today, the lobbyists are really well aware of the fact that there are still points in this bill that people have issue with. The public option is a concern, and how this bill is going to be paid for is a concern. So I think we're just starting to see the beginning of what was going to be a lot of noise going forward.
Ryan, give me your take on these numbers that we had for PricewaterhouseCoopers yesterday. The average family will be paying $1,700 more by 2013 for their premium. 10 years from now, $4,000 more. Individuals will get hit the hardest, paying 49% more 10 years from now. Of course, Max Baucus now is saying that these numbers are riddled with error. What's your take?
Well, it's awfully hard to say that you're going to put about 15 new tax increases, most of which fall on the health insurance sector, as well as all sorts of new regulations on health insurance, the most pernicious of which would be people could wait until they're sick to actually sign up health insurance.
Right.
That has a cost, and that's going to drive up health costs going forward, and it's really unavoidable.
Myrtle, what is your take on the numbers?
Well, everything I've seen so far says that there are a lot of questions about the numbers. That's not to say that there aren't pieces of them that are correct, but even the MIT professor that has really been so vocal on the Massachusetts plan has come out to say that the numbers have some issues. That said, we still have to figure out a way to pay for this bill. And I understand the pressures that the insurance companies are under, but at the same time, the president has always said from the very beginning that everybody was going to have to pitch in on this bill. So it's time for the insurance companies to do their part.
Ryan, you know what amuses me? The insurance companies are kind of in revolt because they're not getting enough universal coverage.
Right.
They thought more people stuffed in there at lower rates would work. And I don't hear them arguing for a full deregulation, Ryan, across state lines. I mean, these insurance companies, they love their monopoly oligopoly, don't they? I mean, I don't know that I'm so sympathetic to them.
Well, this isn't about being for the insurance companies or for any particular sector. It's about being for freedom. It's about being for what will actually work. And one of the best ideas you just mentioned, Larry, is being able to purchase health insurance across state lines. So if you have a state like New Jersey or New York or Michigan that has very high health insurance costs, why not allow people in those states to buy a plan that's in a little bit of a cheaper state? That might not be terribly popular with the insurance companies. It might not be terribly popular with Democrats in Congress, but it's the right thing to do and it would work.
I mean, Myrtle, let me go to you on this. If I feel a lot better about it, the insurance companies were for interstate deregulation. So if more people have to be covered, all right, then why not shop around the whole country? That'll bring down costs, would it not? I mean, that's my question to you. Would that, in fact, make it more cost competitive?
You know, I think that's yet to be shown, Larry, because at the end of the day, the other piece that is still a challenge is making sure that the insurance companies, when they have this big pool of people in place, really do provide the kind of support, premiums, health care that we're all intending for them to have. So I think one of the other things that we're going to see coming out to the forefront in the next couple of days is even thoughts around a state-run healthcare programs, one that would be put in every single state as an option for full care provided by insurance companies and another option against, the public option, if you will.
Myrtle, I want to go back to a point you made earlier. I mean, you're saying that everyone's got to pay. It's been clear from the beginning, and indeed this study shows even individuals, who we thought would be better off, who aren't part of a big plan, they're going to pay 50% more. If we're all paying more, how are costs being contained? It seems like these are, don't go together.
Well, the numbers that we see about everybody having to pay more, especially the individuals on their premiums, those numbers are numbers that are suitable for the next 10 years, if you will. So when you think about the increases in costs over the long period of time, the costs don't seem so out of line, if you will, versus if someone had to incur those costs all at once. So the other way, though, I think that costs have to be addressed, and this still hasn't been a major part of any discussion, and that is how is the delivery of care in this country going to change so that the costs that we keep talking about are in fact realized?
Okay.
So I think we'll see lots more discussion about that.
All right, and we have to leave it there ourselves. Thanks to both of you for joining us. Trish.